Hey everyone, how's it going? So we're expecting this to start rather soon. Let me get this camera set up so you can see me all right. Beautiful. So I've got that thing that was pulsing there in the background on my screen, so we're going to flip to that as soon as that comes up. Just as we get the stream started here, let me know if you can hear me okay. We're going to get started here pretty quickly, and if you haven't already done so, make sure to drop a like on the stream so that more people who are looking for this announcement can find it. So right now, since we're still waiting on this stream to start from the actual press conference, we're going to take a closer look at any details that we already have when it comes to what this new order could be. So let me pull that up here. We're going to look at this article because I'm not too familiar with what exactly is going to come into place, because there's already some things that have started here. All right, let's pull this up. Okay, you should be able to see that, and I'm just going to okay, beautiful. All right. Okay, so it says here, Ontario Premier Doug Ford expected to announce stay-at-home order. Yeah, and as a reminder, I have the actual stream on my on the other monitor here, so I'm just gonna pull that over when we get down to that actually starting, because it seems like they're late again. This was supposed to start at 2, but as of right now, it's 2:30 past 2:30. It still hasn't started, but we're going to pull that up here as soon as we possibly can. Hey Frank, how's it going? It's nice to see you all in the chat. Let me know where you're tuning in from. It's likely that most people here are all from Ontario, but maybe we can get to someone from every different district. Sometimes on these live streams, we try to get everyone from different places in Canada all on here. But so it says here, Ontario Premier Doug Ford expected to announce stay-at-home order. All right. So, okay. So it looks like it's going to be kind of like the one that they did before the holidays, I believe, or just after the holidays. The Ford government is set to announce a province-wide month-long stay-at-home order today, along with a provincial state of emergency. Okay, here we go. I'm getting some audio here from the press conference. I don't know. Let me know if you can hear that music. All right. As of right now, it's still not... they're still not there in their chairs, so I'm going to keep monitoring that. I'm going to mute it, and we'll go back to that article, and as soon as they sit down now, I'll bring it over there. Wow, they're quite a little bit late here. Okay, so it says... Sources tell CP24 and CTV News Toronto that the order will take effect just after midnight today. Okay, so like early tomorrow morning, and will close all retail outlets for in-person shopping other than grocery stores and pharmacies. Okay, so all retail outlets, I guess things will be going back to only curbside pickup in most cases. Big box stores will be allowed to open for sale of essential goods only. All other retails, including malls, will be restricted to curbside pickup. That's interesting. I think that's what Shane Allen there in the chat was mentioning, and we were talking about a little bit there, Shane, was that it looks like this time the big box stores aren't going to be able to keep those sections of the stores open that are that are selling things that aren't essential. As a reminder to people who are tuning in here to the stream, we're going to switch over to the live stream once they actually sit down. Right now it's just a video stream of a couple empty chairs, which isn't the most entertaining, I'm sure. Yeah, dramatic music for no reason. I could put the dramatic music on in the background of this right now when we talk if we wanted to. Oh, man. So the order is expected to last 4 weeks, meaning it could end on May 6th. Premier Doug Ford, Health Minister Christine Elliott, Solicitor General, they're going to go live at 2:30. Well, clearly that's not the case anymore. Okay. All right. Still nobody there. Cabinet met Tuesday afternoon to determine the restrictions after Ford said more must be done to quell the inferno of cases coming from Toronto, Peel, and York regions. Yeah, that was a little bit of the criticism that came last week when they announced the first restrictions that came out. They were saying, like, what's this actually doing for these high-risk places, Toronto, Peel, York? Is this really changing anything? I think the only thing that really changed was the closed patios, right? But not a lot changed from that first one. So a lot of people were questioning if this was actually going to do anything beneficial. Cabinet met again on Wednesday. All right, and approved the third state of emergency in a little over 1 year. Wow. Which will allow the government to impose an enforceable stay-at-home order. Okay, that's a little bit interesting. Remember that one that happened in Ontario a little while ago? I don't think that was technically enforceable, right? We didn't see people getting tickets very frequently, right? Like it'll be interesting to see how they plan on enforcing this stay-at-home order. Speaking on Wednesday morning, Education Minister Stephen Lecce told CP24 the stay-at-home order will not require any public school to close. Interesting. Interesting. Okay, so no public school closures based on these sources. All right. Again, we're still looking. I'll show you. We're still looking at two big chairs empty and like the sound guys hanging out. So we're gonna keep going through this article and get an idea of what we could expect to hear here in this announcement. So it will not involve any closures of schools. It was our promise to keep schools open and to keep them safe. Okay, I'll have to go back and watch that announcement from Stephen Lecce there, because that sounds like an interesting decision. Okay. Public health officers in Toronto, Peel, and Wellington, Dufferin, and Guelph have ordered all schools in those jurisdictions to close over the past 2 days. Okay, so I guess that's more of a regional decision, and maybe it's not something the province can have total authority over. The York Region District School Board also passed a motion Wednesday asking that region's medical officer of health to allow them to move all classes online. All right, Ontario's daily, okay, so it's increasing province's active caseload. So these are just some of these stats. All right, so okay, so it seems like they're not going to be closing schools. As of right now, that's what it seems like based on these sources from this article that we're taking a look at here. And also the different thing from previously is that it sounds like, again, from the sources on this article, we're going to know for sure here in a couple more minutes here when this live stream actually starts rolling. Since I'm talking to you, I'll put that up here so you can see it on the main stream. Yeah, so we'll just wait here for them to get started, but it seems like the main difference is going to be the fact that the big box stores, they're going to be able to remain to stay open just like last time, but it seems like they may have to be required to be sectioning off the sections that aren't essential, right? Because everywhere else you have to do curbside pickup. All these small local businesses have to do curbside pickup only. And that caused a lot of people to be kind of frustrated with the fact that the small businesses weren't able to be open and operating in the same way the big boxes were. So, we got a sound guy here, a development. All right. Yeah. So that's one of the things that we're thinking is going to be changed this time, is that, like, if you go into a Walmart, you can walk all to the different sections. They're probably going to have to rope those off so that you can only go to the grocery store, the pharmacy section, just like the other retail sections that are forced to close, right? It didn't really make sense. You could buy the exact same thing in Walmart that you couldn't go in and buy from a local business. So that's what we're expecting here when they get started. All right. Is this going to be dramatic music again? Oh, no, it's relaxing. Oh, okay. Still a little bit dramatic. We'll turn that down. We got a little bit of background music now. Let's take a look at what's going on here in the chat. Thanks for tuning in, everybody. Again, we haven't really done this before on one of these live announcements. Sometimes we've covered some things on benefits and changes on a federal level, but I figured I was going to watch this today anyway, so why not open it up and have a place that we can all chat about it and see what's going on and what's going to take place. I've got my iced coffee here. It's a beautiful day. All right, taking a look at chat, we've got no need to close the box stores or open all. Need to close the box stores or open all. I mean, when it comes down to like being fair to business owners, I mean that does make sense. You got to be on the same page about things. Are you making a video on the CRB update? I've made videos on most of the updates that have happened, unless there's a new one that's come out in the past couple hours since I did my research this morning. All right. Yeah, those sections tend to have a small amount of people. Yeah, okay, so that urbanized dreams, that's a good point. Also, small businesses should remain open since they can limit people inside easily. Interesting take. Yeah, end of the world music. It is pretty intense, isn't it? Yeah, 90s cell phone ringer music. That's funny. Like, you'd think that the provincial government would have the budget to maybe buy at least one good song to put on loop. I don't know how that licensing works, though. Hey, I see you in here, Liz. How's it going? Got my iced coffee. Beautiful. Candace says, watch it with friends. Exactly. I'll get to watch it with all of you. I like making the videos on my channel, but I really love doing these live streams because I get to actually like one-on-one chat with you and hang out and see what's going on. So that's a great opportunity. Like, that's how I got to know you, Candace and Dixie, and these people that are in here regularly when they're doing live streams. Shane's in here. I've seen Kimberly before, Roxanne. I love it. All right. Yeah. Thanks for tuning in, Roxanne. Yeah. Hunger Games income. That's what the music sounds like, doesn't it? All right. Let's see if we can find any more information on on what could be included in this, because right now we're just staring at a couple chairs. This is grade A entertainment for me right now, you guys. Just staring at the Doug Ford's empty chair. All right, let's go and see if we can find any more new information that wasn't in that original article we were looking at. Yeah, Michael, maybe UBI is a pipe dream, but if you saw the video on my channel that I posted this morning, there actually is a vote coming up on the weekend for the Liberal Party to determine whether or not they're going to implement UBI into their policy. So check out that video on my channel if you haven't already done so. There's going to be an interesting vote here on Saturday. All right. Doug Ford expected to announce stay-at-home order. That's what we just saw. Ontario Cabinet considering. Yeah, I'm trying to find the most up-to-date information for you. Scrolling through here. Yeah, everyone's saying, oh, he's going to announce it at 2:30. Oh, well, we're 15 minutes past that, aren't we? Okay, we've got a Blog Toronto article. Let's pull that up while we wait. We'll keep this this nice music going. Announced tomorrow. Okay, I'm going to try to sort of parse through this so that we're not looking at everything a million times. Okay, oh, we've got a quote from Ford. Is there a stay-at-home order coming? Premier Ford is asked. He references packed parking lot at Yorkdale Mall, which is open under guidelines. Really? So Yorkdale Mall, I used to live in an apartment like really close to Yorkdale Mall. A very large mall, very popular. I'm surprised that was able to stay open during the previous restrictions. He says only go shopping if essential, like getting food or a vaccine, he says. Interesting. Seems like more news coming from the Premier tomorrow, read big employers and neighborhoods in hot zones. Lots of hints about more to come. Okay, so they're sort of dropping bombs here, saying like there's going to be other details that we don't know yet based on what he's said. Okay, this music is making me think that there's something more intense happening on screen. It's probably just two chairs with dramatic music. Yeah, okay. Oh, man. So yeah, if you're just tuning in, thanks for hanging out here. I was going to watch this stream anyway, so I figured, hey, why not do it with a bunch of friends and people who want to sort of discuss it and hang out. We're going to take a look at more information here while we wait for those chairs to actually have someone sitting in them. All right. With Ontario now just a few days into the latest iteration of a province-wide shutdown, medical officers of health for Toronto, Peel, and Ottawa urged the province on Monday to further tighten restrictions. It's going to be interesting to see how they actually enforce this. Is it just going to be like the last stay-at-home order where they didn't really do much to force these things, right? They couldn't pull people over right on the side of the street when they were going places. It was a little challenging to figure out how exactly that would work, but based on the data, it looked like it did at least a little bit. I'm in Alberta, but I'm watching this. Yeah, in Alberta, yeah, 4 chairs, Trisha. Yeah, this is what it feels like sometimes, with depending on the politician that's sitting in it. Yeah, Shane Ford, malls are open. Also, Ford, why are you going to malls? Yeah, right. Like, why would you keep it open if you don't want people going there, right? Well, how much essential is really inside of those big box stores? Oh, music fading. Maybe it's not. Maybe I'm just crazy. Okay, Four chairs. 1, 2, 3, 4. That's my bad. We got 4 chairs here. That's an update. This is breaking news. We've got some chairs and some dramatic music, everyone. Stay tuned, folks. Oh man. This is the thing with live streaming, right? Because we get these updates on when timelines are going to be, and I start the stream and then we end up waiting like an hour until we actually get what we're here for. But that's the way it goes. We were doing this for an extension of the EI benefits a little while ago, and we watched like a whole Senate debate leading up to the debate that we were expecting to come. Oh, music stopping? Or is it just transition? Okay, just transitioning. But we basically watched a whole debate on a different topic, expecting them to transition into the EI extension talks that we were there to see. And then they were like, okay, you know what? It's getting a little late. We're going to end Senate right now. And we'll do it tomorrow. So we had like a 3-hour live stream. They didn't even give us information. So, oh man. Yeah, maybe they're still eating lunch, having a late lunch. Not indoors though. All right. So I think they have to declare a state of emergency to go back to stay-at-home order. They say a stay-at-home order is issued by the province through an emergency order. Is necessary to prevent and mitigate large-scale morbidity and mortality and irreparable strain on the healthcare system, wrote the medical officers. Okay, so yeah, so this is the letter that came out that was, I guess, a coalition of a bunch of different medical officers saying, hey, we're not doing enough. Well, let's pull this up. I didn't actually take a look at this. Wait, okay, so is this just a Twitter feed? I don't tweet a lot, but if you guys have Twitter, you feel free to follow me at Russ Matthews 32. Yeah, I definitely don't tweet a lot. I'm more tweet about the Leafs than I do anything anything else. The COVID situation in Ottawa is concerning. We need to further. Oh, is this the letter that they're talking about? I'm looking at chat, seeing if. Okay. So I don't think this is the. Oh, okay. Here's the letter. So this is, I think, what has prompted this new these new restrictions. Okay, I'm zooming in, but it's getting smaller. Okay, we're gonna stick with that. It says, given the rapid deterioration in local indicators across 3 public health units, so everyone who signed on to this letter, impose a province-wide emergency break, seen rapid cases increase, data, third wave COVID-19 is here. Younger Ontarios are, yeah, I've seen younger Ontarios. I'm interested in what age are the ones, like, what does younger really mean? I'd be interested in seeing that, because most of the articles I've seen have just said younger. I'm not saying it's not true, certainly. I'm just saying I want to know what those actual ages are and what the distribution is and how that's changed over time. Furthermore, Ontario is not unique. Following conclusions and recommendations made in Public Health Ontario evidence brief were informed by an analysis of jurisdictions. Okay, so blaming it on the variants as why we're bringing that in. Evidence from Europe demonstrate that any public health measures implemented must be swift and intense. We've seen this with, I believe, out in BC, they did like a circuit breaker lockdown, right? They were just going to say, hey, we're going to shut everything down for 3 weeks, and then it'll get us back to a sustainable place, and then we can keep on going from there. Variants of concern are the current trends. This is in keeping with advice. All right, so it's a whole bunch of data here saying that the variants and we are the cause of concern, and we need an emergency order to shut things down. All right, so they're calling on the government to review all business and services presently defined as essential. Okay, so determining what is truly essential, I guess, is a priority here. Identifying businesses and services that should be removed from the current list of essential services. Identify which services and businesses with a large square footage are essential. Yeah, okay, so this is what we're talking about, right? How they may be closing down the big box stores, at the very least, the sections that aren't deemed essential, right? Yeah, where is this dude? I agree with you there, Haroon. Yeah, leaks of video. Say bye-bye to our economy. Yeah, I mean that's definitely it's a balancing act, right? Like, what is going to be? Oh, music stopping. Okay, is this a sign? Okay, let me find. Oh, it's just chairs. Okay, here's what I can do. I can. There we go. Maybe we can expect an announcement now. Okay. Too much for a live stream about a lockdown. Maybe. This is what we were looking at. We were looking at Twitter. So they're saying they're going to identify businesses and services defined as essential, set capacity limits of not more than 50% for essential businesses that are permitted to remain open, impose travel restriction between regions within. Okay, so these are all hints at what could be announced here. Right? Oh, here we go.
There's no doubt.
Okay.
The third wave
Let me get.
has been different from anything we've faced so far.
I'm going to turn this up for you.
Now, we have a two-part strategy. First, get needles into arms and limit mobility, limit the spread to protect our ICUs and hospitals. We need to get the vaccines where they will have the greatest impact as quickly as possible. Yesterday, we announced new details on how we're going to get more vaccines to hotspots right across the regions as quickly as possible. This will be critical to getting this third wave under control. We're moving into the next phase of our vaccine distribution strategy. As we speak, mobile vaccination teams are being organized to get vaccines to where they will have the greatest impact. We're deploying numerous mobile vaccine clinics in shelters, residential buildings, community centers, as well as churches, mosques, synagogues, temples, and other faith-based locations in the highest risk neighborhoods. This will include mobile vaccine clinics in high-risk workplaces that will remain open for the sake of our supply chain, starting with those in hotspot regions. As we bring these mobile clinics online, vaccines will be eligible for people aged 18 years of age and over in the high-risk neighborhoods. Friends, our frontline education workers are absolute champions. And while our experts tell us that schools remain a safe space for students and workers, we want to do everything we can to keep them the same way. So beginning next week, workers who support students with special education needs across Ontario, as well as all education workers in high-risk neighborhoods in Toronto and Peel, will be eligible for vaccines. And as the supply allows, we will expand to more high-risk neighborhoods in other hotspots, followed by a rollout to all education workers across the province. And as we ramp up our vaccine distribution, we also need to make sure we take the steps necessary to slow the spread of the virus and protect our ICU and hospital capacity. The reality is, despite everything we've done so far, the COVID-19 situation in Ontario is getting worse as these new variants continue to spread. Our hospitals are reaching capacity, and patients in the GTA must now be sent to other parts of the province for care. In fact, we learned yesterday morning that admissions to ICUs in the past week are increasing faster than the worst case scenario predicted by our experts. My friends, I'm hearing from more and more of our hospital CEOs about the situation in our hospitals and ICUs. I can't stress this enough. Things are extremely, extremely serious right now, and I'm extremely concerned. The situation is evolving rapidly, hour by hour. And as things change, as we learn more about these deadly new variants, as we see new problems arise, we need to adapt. We need to move quickly and decisively. And right now, above all else, our plan is to get needles into arms and protect our hospitals. That's why today, on the advice of the Chief Medical Officer of Health, I'm declaring a state of emergency with a province-wide stay-at-home order effective 12:01 a.m. Thursday.
Exactly
this will be in
what we
effect
expected from our previous sources.
for 4 weeks. With a few exceptions, the stay-at-home order will be similar to what we went through earlier this year. To boil it down as simple as possible, folks, please, unless it's for an essential reason, please stay home. Because the situation is extremely serious, and we just need to hunker down right now. We need to limit mobility. Non-essential retail stores will go back to curbside pickup, with delivery allowed from 6 a.m. to 9 p.m. Big box and discount stores will be allowed to sell essential items only. I'm going to repeat that, essential items only, such as food, medicine, cleaning supplies, and personal care items. During a stay-at-home order, residential evictions will once again be suspended.
Interesting.
Because no one should live in fear of losing their home. And these measures are in addition to the emergency brake shutdown we imposed last week. I know this is tough on businesses, but I promise we will continue to have your backs. In our 2021 budget, we doubled the Ontario Small Business Support Grant, providing eligible small businesses up to $40,000 to get through this. But with these additional measures, we will limit mobility, limit the spread, keep people safe, and allow more time to deliver vaccines. And be assured, vaccines remain our best hope to beat this virus. Yesterday, we administered a record number of vaccines, over 104,000 for a total of 2.7 million to date. We also booked more than 100,000 appointments yesterday, and as of noon today, we have 128,000 appointments already booked for a total of 1.6 million appointments to date. And I continue to ask everyone to get a vaccine as soon as you're eligible to do so. Please, folks, this is how you can help us. All Ontarians 60 and older are now eligible to book their vaccination appointments by visiting ontario.ca/COVID vaccine or by calling 1-888-999-6488. That's 1-888-999-6488. And for all Ontarians 55 and over, we're rolling out vaccinations at more than 700 pharmacies across the province, with more added each week. You can visit ontario.ca/pharmacy COVID vaccine to find a neighborhood pharmacy that is administering vaccines. My friends, make no mistake, these next 4 weeks are absolutely critical. We have come so far already, and we just need to stick together a little longer because hope is on the horizon. I promise you that better days are ahead of us. Based on the vaccines we expect to receive from the federal government, so as long as they come through, I'm expecting that we will be able to have 40% of Ontario adults vaccinated by the end of the 4-week stay-at-home order. And that's when things start to change dramatically in our favor. But the decisions we make now, how we handle the next 4 weeks, what we do until we start achieving mass immunization will be the difference between life and death for thousands of people. And I can't put it any more clear than that. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Okay. So there's the bulk of the announcements. Well, we're going to go over a summary of it soon. We're going to keep watching here, though, for now.
Like other jurisdictions across Canada and around the world, Ontario is in the third wave of the pandemic. However, this wave is different. COVID-19 variants are transmitted more quickly and easily, putting even more lives at risk. In recent days, we've continued to hear from our health system partners. They are concerned. Many of them are afraid. Our hospitals are being hit hard. Intensive care units have more patients now than they ever did in previous waves. With many hospitals at capacity, we are seeing patients being transferred to other hospitals for the care they need, sometimes hundreds of kilometers away. While we commend this Team Ontario effort by our hospitals, we know this can be devastating for patients and their loved ones, and quite frankly, it's not sustainable. And while best efforts have been made, long delayed surgeries and procedures are being canceled. This is devastating, not only for patients and their families, but healthcare workers who face the consequences of our strained healthcare resources firsthand. Additional measures are needed to address the rate of COVID-19 transmission. That's why we are enacting additional public health measures and a stay-at-home order to preserve health system capacity and to save people's lives. This will not impact essential retail settings such as grocery stores and pharmacies, which will continue to have in-person shopping with restrictions. However, big box stores will be required to limit retail sales to essential items. This includes grocery items, household cleaning supplies, pharmaceutical items, healthcare items, personal care items, and pet care supplies.
Pet care is in there.
Other changes include additional restrictions for non-essential retail, including permitting only delivery and curbside pickup with restrictions. Access to shopping malls will be restricted to specific purposes, such as access to designated pickup locations via appointment. These are difficult but necessary decisions, and our government will continue to respond decisively to the realities of the COVID-19 pandemic using the best evidence and advice we are given to protect the health of Ontarians. We have heard health experts talk about how we can look forward to a more normal summer. However, we are not there yet. It will take a collective effort from all of us. Our vaccination rollout is strong and focusing on our most vulnerable populations. However, the current level of vaccination is not enough to prevent the spread of the virus that we are currently seeing. Yesterday, as part of phase 2 of our vaccine rollout, we announced we are expanding our efforts to ensure people in hotspot regions are prioritized to receive the vaccine. To support this expanded vaccination effort, mobile teams are being organized to administer vaccines in high-risk congregate settings, residential buildings, faith-based locations, and locations occupied by large employers in hotspot neighborhoods to individuals aged 18 or over. Pop-up clinics will also be set up in highly impacted neighborhoods in collaboration with public health units and community organizations. We are making steady progress, but until everyone can get vaccinated, please follow all public health measures and please sign up to get vaccinated when it is your turn. We need all Ontarians to do your part to stop the spread of this deadly virus and keep our families, loved ones, and communities safe. Thank you. And I'd now like to hand it over to the Solicitor General.
Thank you, Minister Elliott. As the Premier stated, the Province of Ontario has officially enacted its 3rd provincial declaration of emergency in response to COVID-19 and variants of concern. We do not take this decision lightly, but we are seeing alarming daily case numbers, and hospital capacity is being stretched to the limits, despite the health measures we've asked people to follow. At this critical period, urgent action is required to slow the surging spread of COVID-19 and save lives. Effective Thursday, April the 8th at 12:01 a.m., a stay-at-home order will be implemented, requiring that people only leave their homes for permitted purposes such as groceries, going to the pharmacy, and medical appointments. All businesses must ensure that any employee who can work from home should be working from home rather than going into the workplace. We are also urging Ontarians to restrict travel outside of their home region. I cannot stress enough how important the actions of each individual in Ontario will be today, tomorrow, and in the coming weeks as we confront this threat to the health and well-being of our communities. It is critical, now more than ever, that people adhere to the orders and follow public health measures. Please stay home, stay safe, and let me be clear, these measures will be enforced. We know it hasn't been easy, and nothing about this pandemic has been. Ontarians have already made immeasurable sacrifices, but we need to do more. To make a difference and to help keep people safe, extraordinary action is needed from every single one of us. This is about saving lives. Stopping the spread of COVID-19 can only be done by taking the necessary precautions and following measures that will protect our families, our neighbors, and our communities. Thank you.
Well, Ellie, before we take questions, I want to address something about the paid sick days. You know, my message to the opposition and everyone else, because there's a lot of people that are playing politics right now, and it's totally irresponsible. They're doing a disservice to the people that they're telling this to. There's paid sick leave from the federal government. And I want to thank the Prime Minister for mentioning that yesterday at his press conference. It's greatly appreciated. Folks, because of all the premiers and the federal government, we negotiated $1.1 billion of sick pay. There's still $750 million available. And to get paid sick days, go online to www.canada www.canada.ca/COVID-19. That's www.canada.ca/COVID-19. So far, 300,000, that's 300,000 Ontarians have accessed the program already. So to all the opposition and everyone that's preaching about the sick days and playing politics, rather than do that, why don't you try to help someone by telling them where they can go? That's a disservice if you tell them anything but that. So I'll be ready to take questions, Ellie.
We'll go to the phone line for questions. First question, please.
Your first question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, Cynthia.
Hi, Premier. The Health Sciences Table warned weeks ago that the third wave was going to be driven by variants and that this was going to happen. Instead, you chose to start easing restrictions. Last week, the Sciences Table recommended a stay-at-home order. Only 6 days later are you actually implementing one when it seems your back was up against the wall. Why did you wait? And are you listening to science or aren't you?
Well, I'm listening to health and science, and I listened to Dr. Williams from day one, and I've never wavered from that. But Cynthia, even the people that were showing us the charts and where we were going, the ICU has taken off. The capacity at the ICUs and these variants have taken off even beyond what they told us. And the second I found out yesterday, immediately I asked them to start writing up the orders. This is moving rapidly, every single hour by hour, day by day, and a decision last week doesn't represent a decision today. And again, I want to emphasize that we acted immediately as soon as I found out that the ICU capacity and on top of that, the variant was moving rapidly. I'll pass it over to Dr. Williams.
Yes, well, thank you, Premier. And I think it's important as we get the updates from our modeling table that looks at projections and the data that's coming in, we pay close attention to all those aspects, including the inputs from all our local public health units, Public Health Ontario, and other aspects on our federal, provincial, territorial committees. These are projections, and we look at them, we respond. I think what is misinterpreted is that by coming with the stay-at-home order now, that things have not been done or undertaken up till now. That's totally incorrect. We have implemented our framework all the way through. We have continually moved our health units into higher levels of limitation and lockdown, even prior to our shutdown order this past weekend. And our attempt to stay and slow the spread, we have seen that we have kept that number below the projected amount, but that's not good enough. Because now we see, even with our numbers having not up to 4,000 to 5,000 a day, the number of people going into ICU, the younger people are going in quicker, are going in more ill, and are impacting our ICUs in a much more rapid rate. Therefore, we have to take even further action. And that's why I am recommended to the Premier and to the Minister of Health that we had to go to a stay-at-home order with other restrictions to try and limit the amount of mobility of our citizens in and around Ontario, because as we've seen over the long weekend, there was still a lot of movement and less than, I would say, full adherence to the care and cautions necessary. So I see these as continually stepping up, much like you would do with a patient. You start with some, you start with others, and you keep enhancing and you move as you need to do to limit and bring this under control. And so now we have this step, and we really have to work hard to get this under control, because our variants of concern, while our numbers have not climbed as rapidly as anticipated, the impact on our population and those going in is higher than anticipated. And we have to take all steps we can to ensure their ongoing care, and we get those numbers back down again to ensure that our healthcare system is brought under control and we can handle this variant of concern the same as we have the other cases before us.
Follow up?
Sorry, thank you. While you were answering, it's just been clarified to me from government staff that it's only teachers in the highest risk neighborhoods in Toronto and Peel that will actually be able to get vaccinated starting next week. Can you tell me how many teachers that will be? And can you give us more details, Premier, on the plan to vaccinate essential workers, say at large factories? How many? And again, why didn't you start that earlier after we saw what was happening at Amazon?
Well, first of all, thank you for that, Cynthia. Let me start off with the businesses. You know, and I'm tired of you know all the politics, municipal, provincial, and federal. We need to work together, and I'm not going to be pointing fingers. At the time, the supply of the vaccines weren't there. Now they're there, and they're doing a good job. The federal government, we're getting quite a few vaccines, and we proved it. Once we have the vaccines, we're able to you know vaccinate over 100,000 people yesterday. I don't know the end result today, but we're going to exceed that again today. So we're focusing on those areas now. Since we have vaccines, we're going into the high priority neighborhoods. We're focusing on the companies. We're going into high priority neighborhoods, literally knocking on doors to pull people down in the high priority neighborhoods. So we're really having a targeted approach. You know, we have a two-prong approach here. This is the plan. The plan is limit mobility to protect our ICUs. The plan to get needles into people's arms. We're going into places of worship. We're going into companies. We're going into neighborhoods. And we're focusing on those neighborhoods. Now, as for the teachers, I understand, you know, with the teachers, if we could go right across the province, which we will once we have more supply, we're focusing to make sure that Toronto and Peel and the special education workers right across the province, the special ed teachers, they're going to get vaccinated. And the other areas, be it Hamilton or Ottawa, they're right behind them. But it really all depends on the volume of vaccines. Keep in mind, for every vaccine we give someone, that's taking it off someone else. Right now, we have behind us 1,000,005 appointments. Is actually now, I think 128,000 people have booked appointments as of noon today. So that's even out of date. That's how quickly it's moving. So folks, please book a vaccine appointment. It is absolutely critical. I mentioned yesterday, ages 60 and older, we had over 1 million people that have not booked a vaccine. I'm going to be as blunt as I can. Your life is in jeopardy if you don't start getting a vaccine, get needles into people's arms. Again, 97% of the people that are dying are 60 years of age and older. And going back to schools, 98.9% of schools are currently open. 99.8% of students do not have an active case. 99.28% of students have never reported a case of COVID. When it comes to staff, 99.77% of staff do not have an active case, and 98.82% of staff have never reported a case of COVID. These schools are safe. They're one of the safest places. And we're going to make sure they're safe by vaccinating the teachers as well.
Next question.
Your next question comes from Antonella Artuso with the Toronto Sun. Please go ahead.
Hello, Premier.
Hi,
I wanted
Antonella.
to ask you, is there a reason why your government has provided so little notice for lockdowns and restrictions that are impacting millions of people? This is further to Cynthia's question. It gives a sense of chaos. It's very frustrating for people. So is there a reason for that?
Well, again, we have the two-pronged plan. We're taking the approach that as we saw the ICU capacity grow, as we saw this variant move, it was different than the experts told me last week. It's simple as that. And as it excelled, and we got the call yesterday saying, hey, it's going quicker than expected, you have to be nimble, you have to be quick. I was decisive immediately. I said, start writing the orders immediately. So if I just stand still and just keep with the same plan and just keep doing the same thing, it doesn't cut it with this virus or the variants that are coming in. You see what's happening out in BC with the Brazilian variant, you know, and as it's moving across the country, it's concerning.
Follow up?
Thank you. Your government said that it had increased hospital resources, added field hospitals, yet we're hearing, as your health minister talked about, surgeries, elective surgeries being canceled, patients being moved around the GTA, maybe farther afield. Why is that?
Pass it over to the Minister of Health.
Well, we have made considerable increases into the number of beds available, knowing that with COVID-19 there would be a large number of hospitalizations. So we've increased the number of beds by 3,100 since last year. We also, even with the budget, put in another 125 million to create another 500 spots. We have been increasing capacity at every hospital that we can, creating as many beds as we can. We also are ready to stand up a mobile hospital at Sunnybrook and are ready to start one in Hamilton as well. But notwithstanding all of these accommodations and the significant capacity that we've built in, the hospitalizations that are happening as a result of these variants are taking over our hospitals. That's why we're having to cancel most surgeries and procedures, many of which have been delayed for a long period of time, and why many patients are having to be transferred from one hospital to another across the province. This is not just a GTA issue. We know that even in Kenora, if they have someone that needs to go to another hospital, they only have 4 intensive care beds. They cannot send anybody to Thunder Bay or to Winnipeg. So this is a situation that is happening across the entire province, and that's why we needed this stay-at-home order in order to be able to get these numbers under control so that we can care for the people who are coming into hospital with COVID, but also people who may be involved in a significant car accident or people who have heart attacks. We need to make sure that we have capacity to care for people that need intensive care, stabilization and care.
Next question.
Your next question comes from Travis Danraj with Global News. Please go ahead.
Hi there.
Hi, Travis.
For Dr. Williams and for everyone. Dr. Williams, last week my colleague John Michael McGrath from TVO asked you point blank if the state of COVID in Ontario amounted to a failure in public policy. You disputed that assertion. My question to you now, amid the backdrop of record ICU numbers, schools closed in the largest city in the province, and rapid variant spread is, do you stand by that assessment? For the Premier, the Minister of Health, and the Solicitor General, do you agree with Dr. Williams that the response from this government has been appropriate and timely, considering the dire circumstances we are all in, and the fact that a third state of emergency is now in place a year after all of this began?
So when you asked the question last week, we said we moved into the so-called shutdown. We took steps to take that into position. As I said, the numbers of cases, and we're not the only jurisdiction, our fellow provinces to the west are facing the same types of issues as we all seek to try and bring this under control. And so I think the policy decisions are timely and at a good pace. We'd always like to be ahead even further if we could see it happening. I think they have to be taken in stride because there's parts of the province that are not affected yet, but as the Minister of Health said, some parts throughout different areas are being impacted at different times in different way. That's how the variants of concern are presenting themselves. They move very quickly and we have rapid escalation. And so we are moving as quickly as we can to put these other restrictions in place to limit the spread. The vaccinations are moving out as fast as we can to cover our most vulnerable populations. So I don't see each of these as a failure or as a total success along the way because we'd have to be preempting that along. Over the weekend, for example, we were in the low 400s with our ICU beds. Our numbers of cases stayed at the same amount, and yet the ICU admissions went up quite rapidly that we didn't see and anticipate. It is because of that situation that we now have to take this step where our cases have only gone up slightly over the week, yet the hospitalizations and the ICU admissions have gone up even more rapidly than was anticipated. And this is a crisis situation in our healthcare system that we want to solve before it gets worse. So I think the situation is one of timeliness and responsiveness, and we'll continue to take those steps. People in Ontario know what they should be doing. people in Ontario what they could be doing. And we said before that you have to be doing everything personally to do your distancing, masking, because in the essence of when you are aware of it, with these variants of concern, the VOCs, if you have them in your area, we're trying to tell you now you need to be very concerned, BVC, and then to be very careful with your behavior and activity when you have those in your area, because it can hit very quickly, and people who are asymptomatic can be transmitting. So the measures that you need to do, you must do all the time, very carefully, because we are doing our part by putting the measures in place, but it's very critical that you need to do your part. We all need to do our part in carrying out this step to bring this under control, as all the other provinces are doing at the same time.
Follow-up?
Okay, so I think that's a good place to end what's here on the press conference. It seems like they're kind of looping a lot of the same things that they've said. I think that I'm having a couple camera issues, but we're just going to sort of summarize what these new restrictions are. I like to stay on on this channel as central as I can get when it comes to the political side of all of this. Let me go back to. All right. Yeah, go back to this. So I know that my camera is not the best, but we're going to go over basically what was said here. So there's a couple new things announced. They said they were going to bring in mobile vaccination teams in clinics. They say that experts say schools are safe, but at the same time, he emphasized that 99.8% of people inside of these schools haven't reported a case, and that they're also going to send more vaccines there. So that's an interesting take. That it seems like it's kind of contradictory things there, but maybe it's just a lack of clarity. They say next week workers who support these students, all high-risk neighborhoods, will be eligible for vaccines. They say that supply chain places, if you work at like a factory or shipping, you're still going to need to work. Everything's moving to only pickup and delivery, apart from groceries, pharmacies, personal care items, and I believe pet supplies were in there as well. They say it's rapidly evolving hour by hour. This is the third state of emergency that we've been put into here in Ontario. It's going to be for 4 weeks long, similar to last time, except the big box stores can't sell any items unless they're essential. I'm seeing some questions here. Yeah, we can walk outside. Not a whole lot has changed. Yeah, Andrew. My camera is not the best right here right now, but usually it's good. So I'm gonna have to figure out these issues. They say people 60 plus are now eligible for the vaccine. 40% of Ontario's adult population, they say, they have the capacity to vaccinate by 4 weeks from now. Yeah, again, I'm just bringing you the facts here. That's all the information I really want to cover for now. They say that the variants are the main thing of concern here. But I just wanted I was going to watch this anyway, so I thought I'd bring you all along with me as I did so. Yeah, thanks for tuning into the stream. We do things like this every once in a while whenever there's a new press conference that we can cover and sort of parse through, figure out what's going on. But again, I'm having these camera issues. I hope you guys got what you need to from the stream, and maybe I'll see you on another one of these in the future. But for now, we're gonna